Hi, today we're going to talk about the Ray Sunset Nasal Mask. This is for pediatrics and it is going to be a vented mask. You will see when you get your package, it will come with the size guide. This size guide does have two sizes. It will be our full face, which we'll talk about in a little bit, and it will be for our nasal. The nasal is going to be color-coded in blue, and our nasal does come with a kit, so it will be kitted as a small and medium, and a large and extra large. This is so that when you do size your patient, you're not gonna have to fumble and get a new package. So if your patient is not a small, you do have the opportunity to grab the medium mask that is within that package. In the kit, you are going to have a mask and a secondary mask. In this example, this is going to be a small and a medium, and you also have your headgear. You also will have a 360 and a 360 swivel on the trunk as well. For my mannequin example, I am going to use the Child Extra Large Nasal Mask. It is recommended when you are placing the nasal mask on the patient to have the TP straps already into place. I am using the extenders that do come in with the packaging because my mannequin is a little bit of the adult size. So it is recommended that you put the TP straps on first, place it over the patient's head onto the nose, adjust your TP straps to where it will fit the patient. Place it around the nape of the neck. What you want to see is the Sunset logo at the nape of the neck, facing the outside. If you have the Sunset logo placed touching the patient's neck, it is backwards or inside out. So you do want to have the Sunset logo facing the outside. And then from here, you're going to strap it on the patient's face. Unfortunately, my mannequin is a little too big, but you get the idea. And then from here, we do have the fin technology. It's called FinTech. What I'm going to do is you can alleviate the pressure on the nasal of the bridge. This piece is the FinTech technology. You're going to squeeze it gently, and you can either push it to the patient and bring the mask to the patient's bridge of the nose, or you can pull it away if it's too tight. And this is going to alleviate the pressure on the nasal bridge. So let me demonstrate that again. Push together gently, and then you can push it towards the patient or away from the patient. So push towards the patient or away from the patient. Okay, and again, that's going to alleviate the pressure in the nasal of the bridge. And don't forget to use your skin barrier to help protect and alleviate pressure. Right here, this trunk is going to be removable if needed. If it is too much dead space, you are capable of putting in Omniflex and attaching your circuit to it to alleviate that dead space. If needed, you guys are able to attach directly to the mask your aerogen. What you're going to need is going to be an adapter to this piece, and then go ahead and attach your aerogen, and you are able to attach your circuit to this.